When giving any medication, always follow these steps and focus on checking the medicine, scrubbing the hub, and keeping air out. To give a medication, prepare a work area that is clean, clutter-free, well-lit, and free from distractions. Clean the work area with soap and water and dry with a paper towel. You can also cover the surface with a clean towel if it is not washable. Gather your supplies. This will include an alcohol wipe, clean gloves, and medication and fluids for flushing, sodium chloride or heparin syringe. Check the medication or fluid. Check the labels to be sure you are giving the right medication at the right time. Wash your hands the right way. Anyone caring for your central line needs to wash their hands before and after they touch it. There are some times when you may be using an alcohol-based hand cleaner instead. Be sure to rub the cleaner over all surfaces of your hands and fingers until your hands are dry. Don't touch anything other than your supplies after you clean your hands. Mix the antibiotics. Some antibiotics are already mixed in the bag with normal saline. Others are effective for 24 hours or less after they are mixed. Those medications come in a powder attached to the IV fluids, and you have to break a seal and mix it together. To mix the antibiotics, break the seal to allow fluid to mix with the powder. Hold the IV fluids upright and squeeze the fluid into the powder. Rotate or gently shake the antibiotic container to be sure that the powder is totally mixed. Turn the antibiotic container so the antibiotic is now on top and fluid is on the bottom. Squeeze air into the antibiotic holder. Release the air and the negative pressure will pull the mixed antibiotic into the fluid mixture. Insert the IV tubing. Your infusion tubing will have a spike that goes into the solution bag, a drip chamber, and several clamps. If you will be using an infusion pump, your tubing will have a special section that will fit into the pump. Connect and prime the infusion tubing. Open the IV tubing supplies. Remove the fluid bag cover where the tubing spike will be inserted. Clamp the tubing using the roller clamp. Remove the spike cover and insert this into the fluid bag. Squeeze the drip chamber and fill it halfway with fluid. Unclamp roller clamp and prime the tubing to remove all air. Clamp the tubing using the roller clamp after priming is done. There are several different types of fluid regulators. Your IV fluids may also be attached to a pump. Put on clean gloves. Wipe needleless connector with your cleaning solution, alcohol, or CHG wipe for 15 seconds. Flush the line first. Uncap the sodium chloride syringe. Remove any air by holding it upright and push the air out from the tip. Attach the syringe into the needleless connector. If there is a clamp, unclamp the tubing. Push the plunger slowly so the fluid goes into the tubing. Remove the sodium chloride flush. Attach the fluid tubing. Be sure no air is in line and be sure not to touch the tip of the tubing. Secure the tubing to the central access site. Set your drip rate. You will often have a flow meter that you can set to either the amount of fluid to be given or the time that it needs to be given. For example, 100 milliliters administered over an hour. After the medication has been delivered, remove the fluid tubing and flush the line with sodium chloride and, if needed, heparin. Here are the steps. Remove the tubing from the needleless connector. If you are giving the same antibiotic again within a 24-hour time frame, recap the tubing so it stays sterile for the next time you need it. The tubing can be used for 24 hours. Wipe needleless connector with your cleaning solution, alcohol, or CHG wipe for 15 seconds. Uncover sodium chloride flush syringe and push out any air. Flush the line with 5 to 10 cc of sodium chloride. Follow the same directions if you will also be inserting heparin. Uncover the heparin flush syringe and push out any air. Flush the line with 3 to 5 cc of heparin flush. remove flush, and clamp the central line tubing. The amount of flush you give may be less for babies and small children, so follow your home medication plan.
Okay, now it's your turn to use your skill kit and practice flushing through your needleless connector.